It's
I
not
guess she
available.
would have,
Oh,
no, maybe I think she would have told in an intention because there's a lot of restrictions when, you're
oh,
pregnant on the food. You have to
yes.
consume. They said you can't consume in India like papaya.
Right,
There's a
right,
myth.
right.
No, they get in a lot of trauma, which to take, which not to take, and they're always
Yes,
wanting to count in some elders in the family. So there's
See,
yeah,
always a restriction and a pressure on a mother,
yeah.
yes,
And
and
if
for
you
the
did
child.
that, it's gonna hurt. It's gonna hurt
Yeah, if
your
you're
fetus, right?
that
yes,
too, and if you
Right.
start breastfeeding, there's 1001 question because they
That's right.
say the food you take will affect the child. The child may pass motion, lose stools, etc.
Yeah, yeah,
So
yeah.
that's also a very big period a
Source.
mother undergoes so much.
Yeah, yeah.
yes,
That makes
correct.
sense.
Subhastri, that is, I want to share this type of points. That is, I put food intake. Some people, they
Yeah.
did not take food properly, and
Uh-huh.
that is nausea or vomiting. So they refuse the food intake.
Yeah, yeah.
It's
Because
very
of
big
morning
challenge.
sickness or how it starts.
Automatically,
Right,
they
right,
reduce the nutrition level.
right.
So that is very big trauma, I think.
It's a very good call out.
Like IFA tablet, they don't take anybody IFA tablet because the constipation or nausea, that is, they don't take any uh, tablets
Right.
like IFA tablets. So I put this.
Yeah, I have one.
Well, yeah.
Cultural, religious, and societal practices also affect a person, right? During
Yes.
pregnancy.
Yes. And
Uh,
could be traumatic.
yeah, and even sexual assault during pregnancy can cause trauma, right?
Absolutely.
That no one talks about that. Actually, many women who are pregnant gets raped, right?
Yeah. Yeah.
So it causes trauma.
Right. All right. So let's say something traumatic has happened, right? We're not talking about difficult experiences, but really something that emotionally you just feel like you cannot cope with. What are some reactions that we see? So, in the immediate, right, as soon as an event happens, a traumatic event happens, there's a set of reactions. And then emotionally, over time, there are different set of reactions. So, let's look at just what's happening immediately. Shock. I mean, this actually speaks to the Tamil word adirchi, right? This is like the source of it. It's shocking. It's sort of like you're not expecting it. You don't even know how to react to it, right? Then you have numbness. You can't believe it. You don't feel much. It takes a while for feeling to actually come back. So that's numbness. Confusion. You see this a lot. People can't actually tell you exactly what happened. Not because they don't want to. Sometimes they don't want to, but it's also because they're actually confused about what happened. If you think about people who've lost somebody in your life, right? You try to like think at the moment when it happened. It's not always easy to bring back the memory of exactly what all happened. For example, my grandfather died when I was 8 years old. It was shocking to me. He died very suddenly. I was very, very close to him. About 10 years later, I started remembering a detail about what I was wearing on the day he died. But I could not remember the color of that dress for a very, very long time. It's an example of how when we are in a state of shock, there's numbness. We're not actually taking in all the information and it can feel a little bit confusing. So that's the disorientation. Difficulty focusing. It's hard for them to give you a story of exactly what all happened, when did it happen, the timeline of what happened, right? So it's a lot of difficulty focusing their attention. Now, these are things that happen immediately following a bad incident that's been traumatic. In your case, the people you might be working with, you may not see them when they're in this state, right? Like you're likely to see them once maybe these incidents have happened in their life and then now they're revisiting something. So what are some of the symptoms that come up when it's over time? Let's take a look at that. So in the days, weeks, possibly months, years after a traumatic event, There's a lot of fear and anxiety, right? This fear never leaves you in a way that you're worried that same thing is going to repeat itself. It's going to happen again. And in some cases, it will happen again. Like if you're in a domestic violence situation, for example, that's a occurrence that's always happening. So your fear is not unfounded. It's actually, you really should be afraid to some extent, right? So fear and anxiety. Mood. You see this in a lot of people that you try to help them and they're pushing you away. They're angry, they're irritable, and you can't understand why they're angry at you. You're only there to help them. They're not really angry at you. This is the side effect of trauma, right? That they're not used to anybody actually helping them. So that brings up a lot of anger and irritability. So it's something to keep in mind when you're trying to help someone. Guilt. Did it happen because I'm a bad person? Did I do something to like bring this upon me? If you're very religious, you may feel like, okay, God chose this to happen to me, and then start questioning the why. So there's a lot of guilt that comes up. Avoidance. A lot of people will not talk about the thing that was the most traumatic thing. I can't even like think about it. I can't talk about it. You're here to help me. I can't tell you exactly what's going on because even seeing you is a reminder that something traumatic happened and I need to talk about it, right? So you see a lot of avoidance. This one we've talked about already, emotional numbness, but it just continues on over a long, long period of time when we're talking about trauma. And then dissociation, which is, if you have the experience of, let's say you're walking and your mind starts to wander and suddenly you look around and you realize you've walked like 5 streets away from where you were supposed to go, or you didn't even know how you got there, right? When that happens, that's what we call dissociation. It's like being out of your body. The mind and body are not connected at the moment. And then lastly, relational difficulties, right? So these are problems in relationships. You can't trust other people. You don't really think that people can actually help you, even if you claim that you're going to help them. So a lot of relationship difficulties, also a symptom. So one thing to remember is that trauma actually affects us on a biological level. So in our body, in our mind, the cognition, and at an emotional, psychological level. So it's impacting you on all 3 levels. Okay, so just very quickly, I wanted to put this up only because I want you to see all the parts of the brain that are actually impacted by trauma. We're not going to spend too much time on this, but the prefrontal cortex, which is the front part of our brain, like right here, everything we do from waking up, following a routine, staying organized, those of you who had to drop your children off this morning, you have to stay completely organized for that to happen, right? The prefrontal cortex is what helps you do that. And when you have trauma, this part of your brain is actually affected. So you can't stay organized. It's hard to do problem solving. It's hard to like regulate your behavior, regulate your emotions. The amygdala, also located right here, that's what is responsible for our emotions, for our fear, how we make decisions. That's also part of the brain that's really affected by trauma. And then hippocampus, which is in the back of the brain, responsible for memory and learning, also impacted by trauma. So I just want you to get a sense of what all parts of the brain are actually affected when we have a traumatic incident. This is just another illustration, right? So our brain is supposed to be like this, but when you're traumatized, your brain is activated to this position, right? Not good, because then you're exposing, what's exposed is your hippocampus and your amygdala. This is emotion. This is what regulates all of our emotions. So we're not protecting that, right? So when it's exposed, You're going to see a flood of emotions, difficulty regulating how you're feeling. And the reason for that is it kind of flips your brain. Trauma literally flips your brain. Okay, so Smita, am I missing anything in chat that I'm not keeping up with?
So these are the terms that you have been using throughout. Any questions that will come, Maria or me will voice it out to you, right?
Yeah, perfect. Okay, so you're going to be in trainings that actually teach you some listening skills, right? Like we're going to do a session on listening skills. But for now, I actually want you to think about a time in your life when something was going on for you. You don't have to disclose what that thing was that you were dealing with, but somebody in your life really, really listened to you. You felt heard, you felt listened. What was that experience like for you? Take a minute to think about that. I'm going to stop sharing my slides because I'd love for us to actually talk about this. Would anyone like to share? Just unmute yourself or raise your hand and I can call on you. Oh, there's Smita, you said a feeling of complete communication, feeling understood and vice versa. Anyone else have an experience of being listened to? Peaceful? Almost feels effortless, right? Like you don't have to repeat it in 6 different ways to be understood. Heard? That's right. The burden becomes less. All great responses. And this happens only because you have the other person's undivided attention, right? So if I said, Smita, tell me what's going on today, right? And then I am sort of like this, that's not, I can tell myself I'm listening, but you don't feel listened to, right? And even the question we ask each other, like, how are you? Are we really stopping to wait and listen to how you're doing? And so the response we get usually is like, fine, right? Even if you're not fine, that's what you're going to say because you're already used to not being listened to.
So so Mahima, one of Dan Siegel's, you just mentioned his flip. So one of his talks, he actually says this: if you don't want to listen and hear what he's saying about how he's doing, don't ask it.
Exactly.
Funny that you brought it up.
Steffi said, brain felt so light. Right. You really feel something in your body that's different. There is a kind of lightness. This is actually why therapy works, right? It's not because the therapist is giving you some brilliant solutions to your life problems. It's actually because you feel heard and listened to, and you actually leave that meeting every week feeling like, oh, something's lighter. I can leave all of that with you. And then when I come back next week, it's still going to be there, but I can at least feel a little bit lighter in the meantime.
So, நம்ம எவ்வளவு அதை பத்தி பேசுறோமோ நமக்கே ஒரு கிளாரிட்டி கிடைக்கும். இந்த ஃப்ளோ ஆஃப் தாட்லயே நமக்கு ஒரு நல்ல ஒரு கிளாரிட்டி கிடைக்கும். ஓகே, இதனாலதான் அந்த ரீசன் ஆயிருக்கும். ஸோ அவங்க கவனிக்கிறத விட அந்த கம்யூனிகேஷன் போய் சேர்றத விட நமக்கு பர்சனலா ஒரு கிளியரான ஒரு கிளாரிட்டி கிடைக்கும்.
Very true. I also saw someone in chat say trust. Yeah, really builds our trust. Okay, let me pull up our slides again. I'm going to skip vicarious trauma. We're going to have a whole session on this in a few weeks, talking about when you're helping somebody, what happens to you, right? You're also getting traumatized, but that's what we call vicarious trauma. I'm going to hold off on that. So let's think about some principles of trauma. I know we're not doing great on time, but I actually want you to watch this one video. It's from a Scottish organization, but it tells you a lot about why trauma-informed systems, why trauma-informed staff are so important, not just in healthcare. This is about healthcare, but anywhere, right? Like any workplace should have a trauma-informed staff who can help people when they need that. So I'm just going to play this. I'll put the caption on so you can read along. If the accent is a little bit hard, let me know. I can also translate as needed. First thing I need to do is take my earphones off so you can hear. All right. I think I've probably watched that video at least 1,000 times, and every time I watch it, it still brings up just a lot of feelings. So I'm kind of wondering if someone wants to say what was that like to watch that? I hope the closed captioning actually helped. So you can, so the accent's a little bit hard at times, but what was it like to watch that? Because that is really the role you're going to take on, right? Like, it's actually helping people who are coming to you within a healthcare setting. But what did it bring up?
Can I talk?
Yes, please.
Yeah. I just learned one thing, because this is going to help my profession. I always used to tell my patients before I start a procedure, if you want me to stop, lift your left hand up. I will immediately stop for you. But right now I learned something. I should instead ask them, how do you like to inform if you want me to stop? Then I can give them the option. If they do not know the answer, I can give them the option. This will make them feel more safe. This is a very good point I learned today.
That's great, because I think you're speaking also to when you have that level of trauma, you feel like you don't have control over anything, right?
Yes, we do not know whom we are dealing with, especially when doing procedures.
Yeah, exactly. Anyone else? Anything else come up for you?
So what I was thinking is that it kind of comes back to what you started with. One of the things that causes trauma, the first point, and I think it was nailing point, that not knowing about the process. And as facilitators, when we in the train panittu, we attended a session about birthing. All of these are inputs for us as I think, to facilitators to be there and talk about the process itself. That itself is taking a step back and informing the people what it's going to be. And இன்னைக்கு this video நிறைய insight கொடுத்தது, because நிறைய பேருக்கு இங்க எல்லாமே தெரியும். All are mothers. எப்படி போகும், ஸ்ட்ரெச்சர்ல எப்படி எடுத்துட்டு போவாங்க, என்ன பேசணும், கத்தலாமா, கத்த கூடாதா, காலை விரிக்கணுமா, விரிக்க கூடாதா, all of this we have talked in extents. But இது பேசி சொல்றது, saying that it's okay, என்ன சொல்றது, வார்த்தைகளாலே ஒரு அரவணைப்பு. That is what is important. Yesterday we learned this. I learned that word, and I think today this video has brought it beautifully. How you can just embrace the person, just even verbally, by saying that I'm there and I want to talk.
Correct.
The confidence and the trust that we give it to the person will make much more difference on them first. Like, we are here to be, to take care of you, and we want to hear you. We will listen to you, so that people will feel more happy about to be listened first of all.
That's right.
So
that's right.
That can be given to them.
Yeah. And Helen, also similar to what you're saying, is making a very good point, right? We should really be thinking and be careful about the words that we use. It's very important. We don't actually spend too much time thinking about what words are actually coming out of our mouth, especially when you're trying to like help somebody and build trust, right? The words actually matter.
வெரி ட்ரூ. ஸ்மிதா சொன்ன மாதிரி, ஹெலன் சொன்ன மாதிரி, லைக் அந்த வீடியோ போகும்போது, எஸ்பெஷலி ட்ராமா இன்ஃபார்ம் கேர் போகும்போது, நான் கொஞ்சம் கொஞ்சமா ரிலேட் பண்ணேன். பர்சனலா ஐ வாஸ் கைண்ட் ஆஃப் இன் தட் ஃபெசிலிட்டியில வந்து எந்த அளவுக்கு நம்ம வந்து வாட்டர் யூஸ் பண்றோம். ஏன்னா நமக்கு நிறைய விஷயங்கள் நம்ம பேரண்ட்ஸ் சொல்லி கொடுப்பாங்க, இன்லாஸ், வீட்டுல இருக்க பெரியவங்க சொல்லி கொடுப்பாங்க. அண்ட் இங்கேயும் நம்ம நிறைய செஷன்ஸ் அட்டென்ட் பண்றோம், நிறைய படிச்சிருக்கோம். எல்லா இன்ஃபர்மேஷன் சேர்த்து அங்க போய் என்ன சொல்ல டம்ப் பண்ணாம நம்ம சொல்ற விஷயம் வந்து வேலிடான விஷயமா, அந்த பர்டிகுலர் பர்சனுக்கு அந்த விஷயம் தேவைப்படுற விஷயமா இருக்கிறது எல்லாத்தையும் போய் அங்க போய் சொல்லாம இந்த மாதிரி ரிலேட் பண்ணி ரொம்ப பார்த்து நிதானமா கொடுக்க வேண்டிய இன்ஃபர்மேஷனை பார்த்து நம்ம கொடுக்கணும். அண்ட் நம்ம வந்து கத்துக்கணும், எல்லாமே தெரியும்னு சொல்லிட்டு அந்த ஆட்டிடியூட்ல போடாம ஒரு ஹம்பிளான ஒரு இதுல போகணும். அண்ட் அப்பர்ணா சொன்ன மாதிரி, டாக்டர் அப்பர்ணா மென்ஷன் பண்ண மாதிரி, தட் வாஸ் வெரி குட் பாயிண்ட். நவ் ஷி அண்டர்ஸ்டுட், she was kind of doing a trauma informed care, but after watching this video அவங்க வந்து சொன்னாங்கல்ல, இப்போ ப்ரொசீஜர் ஸ்டார்ட் பண்ணதுக்கு முன்னாடியே நான் வந்து இப்போ I'm going to give them that option. So I think it's going to take some practice. So எடுத்த உடனே நமக்கு இந்த ஃபெசிலிட்டில போனா வராது. I think it's going to take some practice. So it was a very good video.
Yeah. So Subhashri is also saying understand the pulse of the opponent, reflect, empathizing is very important, more listening.
Moreover, people அவங்களுக்கு இது பண்றாங்கன்னு தெரியாம பண்றாங்க நிறைய இடத்துல. How it is going to traumatize தெரியாம.
That's right. And that is a very good point. The ignorance it's not like intentionally I'm going to harm you, or it's sort of like these things we've normalized that, right? Like it's why are you hear this in with pregnant women a lot, like there are so many women who have delivered babies, you're going to be just fine. Okay, that doesn't actually help me, right? Like it's maybe your way of comforting me, but it actually does not help me to know that. Let's see. I actually want us to take just a few minutes to look at some of our slides again on the principles of trauma-informed care. So you saw in the video there were a few principles that they talked about, right? So I just want to say for Tunai, and by extension, all the people who work with Tunai, all the organizations that work with Tunai, including ACOM, for example, these are the principles that are really important for us. So let me put these up. First is safety. None of these other things matter if you have not made the person feel a little safe, right? For example, Steffi, I think you said idli was your favorite food, right? Okay. When you said that, if I had said, oh my God, that is the blandest food, who eats it? Like if I had said some version of that, I can guarantee you would have probably shut down this whole training. You would not have engaged, right? I didn't create a sense of safety for you to come be yourself, right? I may or may not like idli, that's not the point, but can I hold space for you to make you feel like you're included, you matter? It's wonderful that you love idli, whether I like it or not, right? Those are all things that contribute to someone feeling safe in a relationship. And so if we don't have that, then none of these other principles actually matter. So safety is really, really important.
என்னெல்லாம் பண்ணணும், இப்ப இந்த மாதிரி क्वेश्चन வந்துச்சுனா என்னெல்லாம் பண்ணணும் அப்படினு யூஸ்வலா இந்த பேப்பரை கொஞ்சம் ஈஸியா.
Okay.
Sorry about that, Mahima.
No problem. Next
yes, Mahima, I understood. Like I wanted to give a point when I saw the video. Yes, this was my point. Like I should feel safe before sharing something to others, I should trust the person. And I feel, as you said, that was a good example. Like when I said idli, many in our my friends, my family, and strangers can also laugh, like, what is this idli you're telling, but you gave me that space, and you understood that I love idli. It doesn't matter whether you like it or not, but you gave me that comfort zone to share my views and points. So it actually gave me a good zone to share all the things that I wanted to share. So lovely. Yes.
And it's simple. It's actually not so complicated, right? Like, it's just being thoughtful and having the presence of mind to hold space for somebody else's experience, whether that's your own, whether you agree with it or not. Then when we're talking about transparency, right, when you have the safety built in, then you don't hide the details. Even if it's really difficult news, especially when somebody's traumatized, they're used to people withholding information from them, right? Oh, if I tell you this, it's going to upset you. Or I think you're going to have a reaction. You cry for nothing, right? So I'm going to walk on eggshells around you. I'm not going to tell you. Those things don't actually help people. Being transparent about, you're going to feel bad for the next few weeks, but I'm going to still be here to hold your hand, right? This pain is not going away anytime soon. Something awful happened to you, but just being really transparent helps you build trust. The third is cultural humility. This one is a really, really big one. And I want to make a point of this because we all probably remember the tsunamis that happened in India and Sri Lanka, right? A few years ago. In Sri Lanka, there were a lot of fisher villages that were pretty much just wiped out completely. And a big group of American trained psychologists, therapists went to Sri Lanka to do trauma work with those fisher, volunteer and help those communities. 6 months later, they actually found that the trauma levels had gone up with all the counseling, all the help that they did. The reason for that is, this is true of many communities in India too, this resonates for us. Talking about trauma and processing trauma in the way that Western medicine, kind of psychology kind of says is what should happen, was not helpful for them at all. Actually, what was helpful was the fisher village, getting people together, having them talk to each other, start doing the things that they used to do before the tsunami hit. Those things actually were more healing than talking about their trauma, right? I'm using that as an example because that is an example of cultural humility. So we need to understand who we are working with. So if you are working with somebody who's very different from you, maybe you have more financial privilege, maybe you have a family structure that person does not have. These things matter. So how are you going to connect with somebody who's actually very different from you and not force any method, right? You could be trained in trauma-informed care, but maybe talking about something is not the right thing for that person. But that's okay. How else might you be able to help, right? I can tell you there are times when people don't talk to me at all, but I've just shown up week after week after week by their bedside just to say, hey, I'm still coming to say hello to you, right? That makes a huge difference for them. Maybe talking about it does not. So just keeping in mind that we're all different. We have different ways of reacting to trauma. And so it's not a one size fits all. Right? We can't just go in there with, I have this one trick that I know how to do and it's going to work. So just go with a completely open mind. Collaboration. This is not a power trip, right? You're not going there as the only expert. You have some expertise, hopefully with all these trainings and all the life experience you have and all the trainings you've done before. But we're actually inviting the person we are helping to participate in it. Right? It's not going to work if you have a brilliant idea and you're kind of sharing it if the person is not collaborating at all with you. So it actually has to be a give and take. I can share my idea. I can tell you, maybe this is why you're feeling really down today. And that person can say, actually, no, it's not, right? And so then you can start to like collaborate a little bit and try to understand something together instead of assuming. And the last thing is choice. Any person you work with has a choice, whether they want to engage with you or not. I think Aparna, right? The example that you gave was really, really helpful, right? Like, it's not just about how to start, like what you said about you telling them, this is how you're going to let me know that you want to stop. It's actually about, how do I have choice in what that symbol is, right? It's a great example. So really think about how choice is also a very important component. But these are all the broad principles of trauma-informed care. And we're hoping that everything you do, all the trainings, reflect many of these as you're learning and kind of doing the work. Smita, how are we doing on time? We're at 9:36.
Yeah, it's 11:06 here.
Okay. So in about 5 minutes, right?
Right. And I'm sure
about that
there'll be questions as well. So
yeah,
probably
so let's do this.
Keep 5 minutes for that.
Yeah. What I'm going to do is I'm going to stop after this slide. The content on empathy and emotions, let's do it with our psychological first aid. That actually fits there pretty well. So, and I don't want to shortchange that. I want us to have a few minutes to actually practice some of the skills. So we'll get to that.
Okay.
The last thing I want to say for today is, what does healing from trauma look like, right? First of all, reactions to trauma are really different. They're often diverse, right? It's not the same. People don't react the same way. And it's very specific to each individual. It's not a one size fits all. And I don't know how many times I can say this, and you'll probably hear me say this over and over again. Healing from trauma really occurs in relationships, and there's no two ways about it, right? So if you show up and you build a relationship with someone and you don't repeat the traumas that they're used to, that is what is causing the healing. It's not the best thing that came out of your mouth or the exact right words you used, or it's none of that. It's actually your presence, your commitment, your willingness to like be there for that person. So if you say, I'm going to come at 10:30, be there at 10:30. Right? If you can't be there, let the person know you're not going to be there. Those things actually go a long way in building a relationship. And then this last video, I'm going to actually share. Smita, maybe we can cut and paste this and share it in an email so folks can watch it when they have a chance.
Sure.
You don't have to take time.
Can be done. It can be done.
Okay. So I know this was like a crash course on trauma, but we at least wanted to introduce some concepts. This is, I mean, you don't have to remember all of this. I think we'll have a lot of time over time to like do more trainings, learn these concepts better, but at least wanted to introduce you to some of the language and how do we think about trauma from a clinical sense. So with that, I'm actually going to take any questions you have, any comments. Maybe you're feeling really tired from having listened to all of this. That's fine too. You can talk about that.
A very nice session, Mahimaji. Actually, like you've given us an opportunity to think through in various ways at a 360-degree angle when we approach a mother. Thank you. Thank you for that.
Thank you for that feedback. I mean, I think we all did that together, right? I'm only giving you a template for starting to think about it, but I think everyone who contributed today has spoken to like some version of it. So it's really nice to have all the voices and all the knowledge together.
Yeah, this is our third day session, and I'm very happy in this session you made us interact with others.
Could you say that last part again? I didn't hear that. So in this session, you made us.
I am very happy that you made me interact with all others that I don't know. I'm very happy about that.
Great. I'm glad to hear that. You're going to have to interact with each other a lot going forward, right? So good time to start practicing. Actually, one thing I want to say about that, when we come to trainings, I understand that there's somebody like me who's a trainer who has some there's an expert title or whatever, which is all great. There's value in that. But you realize how each one of us is an expert in our own life, right? Like, I'm not an expert in Smita's life. Smita can never be an expert in my life. Those life experiences actually matter, right? So whether you understand the amygdala and the prefrontal cortex and what happens in trauma or not, if you have a lived experience and you actually understand that, it gives you a lot of power to go help somebody. And a lot of you talked about why you want to do this work, right? Because there's a life experience that you're leading with. I would love for you to own that, right? That's empower yourself with that power so you can actually help the people around you. You don't need extensive knowledge in trauma to help somebody, but you have the life experience that you can lead with, which is why interacting is great, because we hear each other's story and we learn from each other, right?
Absolutely, absolutely. And one of the things that you raised this question early on, why you are here, why the MMH, and what motivates you to be here. And if I was thinking to myself that I had there was no intention about a maternal mental health aspect to what we started doing with Tunai until Ekam came in. And then there was so much realization that it is traumatic. I have been through that trauma myself. Mm-hmm. I want to acknowledge that, yes, I did go through it. And even today, when you were talking about, many of us kept going back to our own stories.
Yes.
And saying, this happened with me. And I think that is actually healing begun. And when you put it on yourself, it's more effective to actually put it on another person. You can be your own scapegoat.
Very true. And I'll tell you, actually, when I picked on the food intake, I was kind of curious about what is that? How is that linking to trauma? I completely forgot about this. When I was pregnant, I just couldn't. I love coffee. I just have to wake up to coffee, especially like South Indian coffee. I cannot live without that. Every person I met was like, oh, when you're pregnant, you can't drink coffee, right? Like, this is a thing that gets cut off from your diet. And I honestly had panic attacks thinking about, how am I going to live without coffee? Like, I cannot imagine a life without coffee. So I actually didn't stop. I kept drinking coffee, and my OBGYN, because I was pregnant in the US, she was like, sure, I just 2 cups a day or 3 cups a day or something, right? Like, you can drink, it's not a big deal. She explained to me why. Still, my family was like, nobody in our family has been drinking coffee when they're pregnant, right? And so now when I see my son jumping off the couch instead of walking, and he's 8 years old, and I'm like, oh, maybe I should have listened to all those people, right? It's a stupid thought. It has nothing to do with why he's jumping on the couch, but it's sort of traumatic to be told to be something else, right? And so the food intake, that was not on my mind, probably because I'm avoiding it. I don't want to think about all of those things that happen, right? It's not just coffee. I'm using that as an example.
Actually, it's very comforting, to hear it from you. You're a psychologist, you have like years of experience. Even அவங்களுக்கு கூட அந்த தாட் வரும். ஸோ நம்ம நினைக்கிறது it's all valid. நம்ம நினைக்கிறது எல்லாமே வேலிடான தாட்ஸ். ஸோ இட் gives us, it gave me some sort of comfort. Okay, மஹிமா அவங்களுக்கும் வருது அந்த தாட். ஸோ நமக்கும்
She just made you human, Mahima.
I know.
இல்ல,
we are all
we have heard, because I completed social work in medical and psychiatry. I had like few years of 1 year of experience in counseling. ஸோ கவுன்சிலருக்கு வந்து எந்த பிரச்சனையும் வரக்கூடாது, they can't have any problem. அந்த மாதிரி my first question will be, அப்ப டாக்டர் படிச்சா உங்களுக்கு ஃபீவர் வரக்கூடாதா, டாக்டர் படிச்சா உங்களுக்கு ஹார்ட் அட்டாக் வரக்கூடாதா? this was my, it's within my family members. ஸோ நீ ஒரு கவுன்சிலரா இருக்கு, நீ எப்படி பண்ணலாமா, நீ எப்படி பிஹேவ் பண்ணலாமா, கோவப்படலாமா, அந்த மாதிரி சின்ன சின்ன விஷயங்கள். ஸோ லைக் when you just said that, it was very okay, fine. Even after years of experience, you also have that doubt in your mind, which has been transferred.
Right. Yeah.
So it kind of gives me that comfort.
Yeah, very true. Right. I mean, and also it's like, it's sometimes easy to work on somebody else's problems than your own. It takes a lot more to actually look inward.
Very true.
In fact, that வந்து இப்போ மரியா சொன்னது வந்து actually it's coming in a full circle. மஹிமா பண்ற அடுத்த செஷன் வந்து is only going to be about you treating, you being, நம்ம வந்து நம்மளோட trauma, நம்மளோட change of thought process, இந்த ஃபெசிலிட்டியில இருந்து நமக்குள்ள என்னெல்லாம் சேஞ்சஸ் வரும், நிச்சயமா வரும். ஒரு டிஃபிகல்ட் சுச்சுவேஷன்ல இருக்கும்போது நமக்குள்ள ஒரு டிஃபிகல்ட் எமோஷன்ஸ் வரும். அதை எப்படி டீல் பண்ண போறோம்? அதனால ஒரு கவுன்சிலருக்கு ப்ராப்ளம்ஸ் வருமான, நிச்சயமா வரும். ஒரு கவுன்சிலர் கிட்ட போறவங்க தான். ஸோ அதனால she's also probably what we can also think of Mahima is that discussion, what is the debrief sessions, once they start actively going. We've already been speaking about this. So all of this will probably address in the next session. So in the next session is very important for us to actually, அது நம்ம practice பண்ணும்போது என்னெல்லாம் நடக்கலாம், அதுக்கு நம்ம எப்படி முன்னையே நம்ம ஒரு செல்ஃப் கேர் ரெஜிம், ஒரு practice நம்மளே டெவலப் பண்ணலாம், அதெல்லாம் Mahima is going to be telling us in the next session.
Which is in March, right, Smita? Few more weeks.
March, same day, March 11th.
Mashallah.
All right. If there's any more questions,
you can also
Maria,
just email questions. Happy to answer them via chat.
Yes,
sorry,
Mahima,
Maria.
I wanted to send you an email. My brother has a problem. I don't know whether he's traumatized or, he has OCD. I'm working on it. I'm not sure about it. So I'll send you a detailed, thing which had happened to my brother. Will you be, able to help me out? If you're
I mean, yes.
Yeah.
Definitely okay to like consult with it, but I'm not, also I can't treat him, right? So professionally,
I'm not
there's a boundary, but I'll send I can happy to chat with you, see what's going on. I'll give you my email.
Okay, thank you.
right, contact information will be given. On that note, Mahima வந்து like the other two sessions, in the session இருந்து what is our key takeaway, இதுல இருந்து நம்ம என்னெல்லாம் கத்துக்கிட்டோம், ஒரு சின்ன நமக்குள்ளே for our own self assessment, நம்ம வந்து ஒரு 5 questions கொடுத்திருக்காங்க. We please respond to that by end of the day, because this is a vital part of the training process. I cannot emphasize the importance of recap and review. அதனால அந்த question link இப்போ மரியா போட போறாங்க chatல. Please எல்லாரும் அதை click பண்ணிட்டு yeah, I have.
So on top of that, previous sessions you வந்து complete பண்ண பாருங்க இன்னைக்கு, because we do need to send it out to our trainers and நமக்கும் வேணும் அது. So time இருந்தா அதையும் quick, it all is going to just take 1 minute to quickly fill up those forms. So yep, வேற ஏதாவது கேள்விகள் இருக்கா? So thank you so much, Mahima, for this wonderful session, and it was very informative, and I hope all our facilitators equally had that very informative so thank you so much for giving your time today, and good day for you, good week.
Thank you everyone. It was really nice to meet you, and I'm looking forward to the next one.
Thank you so much, everybody. Thank you for logging in. Thank you, Mahima.
So
have a great weekend. Bye bye.
Thank you. You too.
Bye,
Thanks,
everybody.
Mahima.
Bye.
Have a good night and good weekend ahead. Bye.
Thank you. Bye.